Hi, my name is Terry, and I have bladder cancer. And I had my bladder tumor removed, and possibly like yourself, I'm undergoing BCG treatment. And I thought I would just share this with you in case you were just curious what it's like and what you can do to maybe minimize the discomfort. Um, I've had three or four done now, and each time it's a little bit different sensation, and it's actually those sensations that can cause some difficulty. Um, what they do is that they insert the catheter into your urethra, which goes into your bladder, and it doesn't, it's not very comfortable. And sometimes I feel like I'm about to urinate. Uh, it's even if I did, it would be no big deal. There's a catheter in there, and but that's not usually by then your bladder's voided anyway, or the nursing staff have voided your bladder by just pushing on it a little bit. So even if you did actually urinate, it really wouldn't do anything because it's going to go into some receptacle anyway. So, but what I have done in the past, which was not good, which was to try to stop urinating, which meant I was constricting my bladder muscles, which caused pain because of the catheter insertion. And I've also experienced almost like I was going to have an orgasm as the catheter came out, and and your nerves in your prostate are being excited, and if the bright ones are just excited enough, that feeling, even though it's not true, the feeling's there. Uh, and trying to stop that is not good either. So if you feel that way, if you feel either way, you should not try to stop it because you're not really doing it. And I know that's hard to say because we all try to stop urinating if it's not appropriate to do so. Um, I asked a number of women, how did you handle childbirth? What are some tips for you that you could share with me? And in terms of living through the pain, and granted, this this catheter insertion in the BCG um, treatment, where that's inserted into the bladder, this whole process takes a minute. So this is not certainly childbirth, but it certainly feels uncomfortable. And it can be painful if you are not relaxed. So how do you get relaxed? Well, besides just trying to relax, breathing through inhaling through your nose and exhaling through your mouth, that helps. Focusing on something like on the ceiling as you're laying down on the table, um, just focusing on something, that helps. And and the breathing is, in your nose and out, very relaxed breathing, not hyperventilate or anything, and and just trying to relax all your muscles. I know that's difficult to do, but the more relaxed you can be, the more comfortable you're going to be, the less discomfort you're going to experience. So that's my suggestion. And actually, people, the office that I go to, they didn't really explain that to me very well. So I've kind of just learned this on my own, and I just wanted to share it with you, and in the hopes that I can make your experience a little bit better. And there you go. Have a very good day, and I hope that you get your cancer in remission also. Bye bye now.